Good morning, all. I am going to rush through a series of small topics. So, your instrument section, even though this is last part of your exam, still it is important. You have to identify the common surgical instruments, its use in indications of surgery, how will you do a pre-operative evaluation, then steps of surgery, complications, and special situations like in cataract, phacoid, or flax, etc. Then, so common surgery like cataract surgery, trabeculectomy, DCR, DCT surgery, etc. So you have to identify all these instruments. So special surgeries like keratoplasty, you have to know about the all these instruments and its indications, surgical indications of the surgery, complications, etc., etc. Then next is specimen, which can be a gross pathological specimen, which can be a full eyeball or a cross section of eyeball, which you have to tell about the section, that is an enucleated or a cross section of eyeball showing a second picture showing an intraocular tumor, second and third picture showing an intraocular tumor, probable diagnosis, and how will you treat. You have to know all this. Then about the histopathology, same. Histopathology can be this retinoblastoma, malignant melanoma, rarely rhinosporidium. So you know the rosette, florets, etc. Then microbiology, I'm not going in deep into that. Anyway, AFB you have to know, leprosy as well as tuberculosis. Then next is HFA, where you have to see the printout, whether it is a full field, 30-2, 24-2 or 10-2. Then look for the patient data, whether reliability criteria is fulfilling. What is the field defect, whether it is a glaucomata field defect, as in this you can see an arcuate field defect, or this is also another arcuate field defect, or it is a neurological field defect respecting vertical meridian. So homonymous hemianopia, retrochiasmal lesion, lesion of the visual pathway. So a retrochiasmal lesion can cause, as I said, homonymous hemianopia. So here you can see a tumor in the occipital area. So here you can see a scan picture. You don't know which is that. So you have to tell at the end which picture is that. So the scanning can be either a coronal scan, axial scan, or a sagittal scan. Axial scan divides the body into upper part and lower part, upper and lower half. The coronal will be passing through so that it is dividing the body into anterior and posterior, sagittal into midline, left and right. So the first picture shows, you can see this picture. This is a coronal axial scan, this is a sagittal scan, and this is last one is a coronal scan. So how will you differentiate between CT and MRI? CT has a low resolution compared to MRI. So bony anatomy is more marked in CT compared to MRI. And structure details will not be that defined in CT as MRI. So bony density is maximum. Density of bone is seen there as the maximum. So MRI is, you can see the greater details. T1 weighted and T2 weighted MRI are there. You can remember T2 by T2, especially strong water is, you can see water as strong as white signal. So both has 2, T2 as well as water H2O has 2. So MRI showing water content in the CSF, that is white as T2 weighted. T1 is CSF will be black in color. So this picture is first picture. Both are, first two pictures are CT and the last two pictures are MRI, and this is T2 weighted. You can see the vitreous is seeing white in this. So here you can see this is a CT picture showing intraocular foreign body. So how will you say in your exam? So axial CT scan showing brain and orbit with name and age of the patient with a high iso, hypo or hyperdense lesion in the eye or in the orbit, wherever it is. So here it is in the eye, close to the lens. So it is an intraocular foreign body. Here you can see another mass lesion, which is isodense with your muscle or brain. Here another, you can see, what is this? Can you describe this? Differential diagnosis? Okay, thyroid. Here also this is the corona section showing enlarged extraocular muscles. So this is also thyroid. This picture you can see pituitary gland. This is an MRI picture which T1 or T2 weighted. Here you can see the CSF.
Black.
Black. White. Okay. Okay. So can you see a tumor here? This is pituitary tumor pressing the chiasma. Okay. Here you can see this is CT showing a bone fracture impinging optic nerve. Here
Calcification.
this is proptosis with intraocular mass with calcification. DD?
Retinoblastoma.
DD? Retinoblastoma. Okay. Here already saw one CT, thyroid. So this is CT versus MRI of intraocular tumors, retinoblastoma. Okay, thank you.
Okay, thank